Xand, I'd like to ask you a favour.
Never mind that, Chris. You know what? I was just thinking that the best thing about being a doctor is that you always know exactly what to do in any given medical situation. It's brilliant.
Really, Xand? Well, what about certain types of elbow fracture?
Like an epicondylar fracture.
An epicondylar fracture, exactly. Or certain kinds of wrist fractures where the bones are really, really out of place.
Ouch.
Would you always do surgery? Or do you always avoid surgery and put on a cast? Would you know what to do?
Well, some doctors do surgery because they think it'll help a child get back to normal life quickly, but other doctors do it differently.
Exactly, Xand. We're not quite sure what to do.
You know what the problem here is, Chris? We don't know what to do. We don't know which treatment is best.
Well, that's exactly what I'm trying to tell you, Xand. That's what I
What
wanted
we need to do is a clinical trial. Okay? Now here's how it works. You take patients with the same problem, like the same fracture, and you split them into two groups. And then when you've got the two groups, with one group you do the surgery, the other group you treat them with casts, and then you see which two groups do better. It's brilliant. It's called a clinical trial.
Yes, Xand, I know that. That is exactly what surgeons are trying to do.
I tell you what, Chris. Also, people get a bit nervous about going into clinical trials.
That's true.
So we should make a video encouraging kids to sign up for clinical trials if their doctors ask them to.
Yes, Xand, that's exactly the favour I've come to ask you to do.
Right, so here's how you do it, Chris. Hey everybody, if you're invited to take part in a clinical trial, you should definitely sign up to do it because you'll get excellent treatment and you'll be helping doctors and patients in the future who come after you.
Well, there you go. That is that's a brilliant example of exactly what I wanted to do. Thanks very much indeed, Xand.
Right, I'm glad we got that done, Chris, because I have a little clinical trial of my own to conduct. I need to clean my toenails, and I'm wondering whether to use your fork or your toothbrush. So I'm using the fork on the right foot and the toothbrush on the left. Bye, everybody.
What?